Well, I had my hip replaced in 1989 and after 22 odd years it got loose. My right hip this is. And I went back into hospital in December 2011 to have it redone. And I got an infection in it and I spent 5 months in hospital.
Mrs Tuck was a patient whose name was generated at the Wells surgery as a lady with high needs. She'd had a hip replacement, there'd been complications with that, and she'd gone into Cranmer House, which is a local nursing and respite facility. From Cranmer House, she transferred to, I think it was Dorrington House in Wells for a little while.
My mother was born in Wells, and I always said when I grow up I'm going to live in Wells. And when I was 18, that's what I did. I came up here and I got a job and I got lodgings, and then I met John and I've been here ever since. I just like Wells as a whole, really, especially the street.
The worry about Mary coming out of hospital was very deep in my mind because I knew that the state her body was in, and I worried about my capability, being so old, to be able to look after her.
For Mary to return home, her property needed a lot of adaptation. It wasn't suitable for wheelchair use. So an occupational therapist from social services visited the home while Mr Tuck was there and talked about what Mary might need.
I don't know how we got in touch with him. Rather, I think they were getting in touch with us and making us informed about what required to be done.
They put in a toilet and a shower and a wash basin in the wet room, which is great, it really is. And I've got bars in the downstairs toilet. They suggested we had the door put round the other way so that it opens outwards, and which we did. See, little things like that made all the difference. And they put me in a stair lift, which is also great because I would never have managed without that. If I couldn't have come back to Wells, I don't know where they'd have put me. But I wouldn't have liked it, wherever it was.
I think integrated care worked very well for Mary. It was easy to discuss and talk about the next step of what was happening, who's going out to see her, what's needed, how is she emotionally, support for her husband while all this was going on was very important.
All those things from which we've received advice from all these lovely people, we are very thankful for.
I can't say enough about them. I was very grateful to the team for getting me home and looking after me like they did.